How to help someone having a seizure. While witnessing someone have a seizure can be a scary experience, they are fairly common, with 1 in 10 people having a seizure during their lifetime. The cells in the brain and the nervous system communicate with each other through action potentials, which are changes in the electrical potential of the cell membrane, moving as a wave to the end of the cell and on to the next. These cells either allow messages to pass from one cell to another, known as excitatory, or block the movement of these electrical impulses, known as inhibitory. When this intricate balance of excitatory and inhibitory cell firing is off, it can cause electrical surges in the brain, which can cause seizures. Now that you know what a seizure is, you should know what to do if someone is having one. Gut instincts might tell you to dial 911. However, seizures are generally not a medical emergency. Medically speaking, not a lot can be done for a person having a seizure. You should stay with the person until the seizure is over, as injuries can occur both during and after the seizure. It's imperative to pay attention to the duration of the seizure, as most seizures last under 5 minutes. It's also important to keep yourself and everyone around you calm. Speak calmly and reassuringly. During a seizure, the body's muscles contract sporadically and forcefully, so move nearby objects out of the way to prevent the patient from hitting them during the seizure. If you can't move the environment, move the patient if the seizure has not started yet, or place soft objects over any rough or sharp surfaces. Seizures are no doubt scary for the patient as well. You should make the person feel as comfortable as possible. Lay them on the floor and support their head with pillows or blankets to prevent it from hitting the floor. You should place the patient in the recovery position, pictured here, either before or after the seizure, as it supports the head and prevents the body from rolling. You should also monitor their breathing during the seizure. If the patient is laying down, you should turn them on their side so it's easier for them to breathe. Certain seizures lock up the chest muscles and make it appear as if the person is not breathing. However, when the seizure ends, the muscles loosen up and normal breathing should resume. And finally, you should keep onlookers away once you have control of the situation. Waking up to a crowd of people looking down at you can be embarrassing. Do not attempt to forcibly hold the person down or restrain them, as they may hurt themselves during the seizure or behave aggressively. It's important to not place anything inside the patient's mouth. The jaw muscles commonly contract tightly during a seizure, and if something is in the mouth when this happens, it may break and the patient may choke. The person will not choke on their own tongue during a seizure. Do not give the person any food, water, or pills orally unless they are fully alert. If they are not fully alert, they may choke on the substance. If they are choking, turn them on their side and request help from bystanders or attempt to clear the blockage yourself. If you are unable to, call 911 immediately. Now that you know what and what not to do for a person having a seizure, how do you know if you need to call 911? There are many types of seizures, all with their own very specific classifications, but in general, call emergency services if the seizure lasts longer than 5 minutes, if the person has never had a seizure before, if the seizures occur back to back without the patient regaining consciousness, or if they happen in rapid succession, if the patient has difficulties breathing or walking after the seizure, if an injury occurred during the seizure, if the seizure happened in water, if the person has any other medical conditions or is pregnant, or if the person asks for medical assistance.